I'm Dr. David McEachin. I'm the Chief Medical Officer for Southwell. I've been a general surgeon in Tifton for 24 years. I've been serving in my present role as the Chief Medical Officer for about 3 years. Southwell is an integrated healthcare system that includes Tift Regional Medical Center, Southwell Medical, Southwell Health and Rehab, and more than 35 outpatient diagnostic and treatment facilities, physician clinics, and endoscopy procedure centers. Southwell is located in South Central Georgia. We're the biggest hospital system within 45 miles of our primary location in Tifton. If you come to Southwell, you'll be practicing in a location where community, family, and friends are very important. But at the same time, you'll be practicing at a hospital system that's very intent on providing first-rate, cutting-edge medical care for our patients.
Hi, I'm Dr. Sharon Nakashi, pediatric hospitalist.
I'm Dr. Andrew Nakashi, general surgeon, and this is
Abby.
That's right.
I decided to come to Tifton just because of the small town atmosphere, the great recruitment process. We really felt like we were entering not just a job, but we were really coming to a family atmosphere, not just in the hospital itself, but in the community as a whole. And we really felt like this was a good place where we could not only grow our family, but we could also build strong relationships within the hospital and the community itself. I've had a great experience so far. It's been wonderful to really dive into the hospital itself and get to know all the team members in the hospital, not just the nurse practitioners and the nurses that work there, but all of the other physicians that I work with on a day-to-day basis. It's like I really have found a true family in that respect, just because we work together, but we also are able to kind of approach problems together and come up with a creative solution that benefits all of our patients. We've really enjoyed getting out and starting dance classes and going to parks and things that, we have enjoyed the sunshine, which we didn't really have much of in Michigan, so this is certainly something that we enjoy a lot of.
When me and my wife were first looking at the hospital and everything, we were really looking into, we really didn't want to be a part of a big corporation, and here it seems more like family. As the recruitment process went on, we realized that it's truly like family. The CEO here is very accessible, along with all of the administration. And as far as my experience so far, there's great mid-level support. I've got great support from my partners, and really enjoyed interacting with the administration and them listening to any concerns or anything I had. I came from Jacksonville, Florida. That's where I grew up, in a big city. But I moved and really lived in smaller cities as I went on. And coming to Tifton, I really enjoyed the small town feel. I like the little things, like people knowing my coffee order when I go to the coffee shop and things like that. And I hate looking for parking, so small town is where it's at for me.
My name is Shannon Price, and I'm an OBGYN. We've lived in Tifton for 6.5 years. My husband and I chose Tifton to move to because we were looking for a small town. When I was in residency and afterwards, we lived in big cities, and we really missed the small town feel. I grew up in a small town in Perry, Florida, and we were really looking for a smaller community where we could really know our neighbors, get to have close friends, and really have a more personal connection to the patients that we serve. So the reason that we stayed in Tifton is because I felt very fulfilled in the practice. I'm very happy working at Tift Regional Medical Center that's now kind of transitioning to Southwell. We love the patients that we serve. The patients stay with us. They love that one-on-one when they walk through the office, and we know them by name. We know their whole history, and we just love having that interpersonal connection that I think sometimes that you lose at larger cities where you're seeing more patients. You may not necessarily know them personally whenever they come in. We've been extremely happy here in Tifton. We love the community. It's a very safe place to live. We love owning our house where our dogs can run free. We just found that this is our niche, and we plan on being here long term.
My name is Dr. Channing J. Hampton. I am an internal medicine physician at Southwell Medical Clinic here in Tifton, Georgia. I have been working in this position for the last 8 years. I also serve as the chair of the medicine department, and I've been serving in that position for the last 2 years. The first place that I did my interview for residency was at Memorial Health in Savannah, Georgia. And at our first interview, I found out that TIF Regional had actually recruited nearly the entire graduating class for the hospitalist program. And they also recruited 2 of the attendings at Memorial Health. So that was the first thing I ever heard about TIF Regional. And so once I was about to graduate from residency, I already had TIF Regional on my list of places because I had already heard about it and I already knew a lot of the people that were going to be at this facility. After that, the other thing that really drew me to TIF Regional is location. My dad is military. I kind of grew up everywhere. And so I wanted to stay somewhere close to home. And so I'm originally from Glenville, Georgia, and my parents stay in Hinesville, Georgia, which is maybe about 2.5 hours away from Tifton. And then my wife, she's from Atlanta, Georgia, so that's about equal distance. So we chose a place that was pretty convenient in terms of getting to our family members, but also that's a decent sized city, so that has pretty much all the amenities we need. Southwell Medical Clinic, it is a very relaxed environment. I would say that with the nursing, with our NPs and PAs, we all collaborate all the time in terms of patient care. And with it being more of a close-knit community, if there's any time that I need to talk to any kind of specialist, they are basically a phone call away. I'm pretty familiar with all of the specialists here at TIF Regional, and I would say that probably comes from when I first started at TIF Regional. I actually did more of a hybrid program where I did the hospitalist / primary care outpatient route, where I did 3 weeks at primary care and then 1 week as a hospitalist. And so through that route, I was able to actually meet a lot of the specialists firsthand through patient care in the hospital setting. And then after that, I was actually able to meet a lot of the case managers, the nurses, and from there, a lot of them would send patients to me that were getting discharged who didn't have any follow-up. And I was also able to discharge patients when I was as a hospitalist to follow up with me in the outpatient setting. So I would say it's outpatient, it's very busy. Within the first 2 years of doing that hybrid program, I switched to just outpatient medicine because my practice got too busy. Of the patient population that you see at TIF Regional versus at a metropolitan facility such as Atlanta or even the Savannah area, I would say I still see a pretty big complexity of patients. With 75 running straight through TIF Regional or Tifton, we see all sorts of patients who are passing through and may get ill along the way. And so you will see every type of disease state that you learn during medical school. I actually have several patients here with rare genetic disorders that I'm the only one in the area that would be willing to go ahead and treat them. So these are actually diagnoses that I never thought I would see beyond medical school that I'm treating here in Tifton, and I have 4 patients with those rare disorders. And even for those patients, I'm actually on the phone with Emory about dosage adjustments probably every 4 to 6 months with those patients, and we actually set up conference calls with the genetic counselors, with the specialists at Emory Hospital, and also with just case managers. So there's no difficulty in terms of treating just a diverse population of patients. In terms of my work-life balance here in Tifton, is actually very nice. And I've actually communicated with a lot of my old friends who work at different facilities. One thing that I'd like here at Tifton is for the outpatient medicine clinic, we actually have 4 days where we see patients, and then we have 1 day that we have as an admin day. And that day gives you plenty of time to catch up with any paperwork, any charting that you need to do, or if you have appointments that you need to take care of during the week. So that is one thing that I see as a benefit of working here at TIF Regional. The other thing I would say is that the administration is very much active in terms of making sure that you're not getting overworked. They are constantly asking during your, I'll say probably every few months, how's everything going? Is there any issues that you'd want for us to be able to correct? Even when I first started here, in terms of my patient load, they started low, and then as I got comfortable with our computer system, they just gradually built everything up. So I didn't feel like I got overwhelmed with work. In terms of life outside of work, I I enjoy it here in Tifton. I would say I live in Savannah. Yes, the beach is right there, but it doesn't take too long for me to drive to the beach from here. And then with 75 running straight through Tifton, there's no difficulty with us going up to Atlanta or going down to Tallahassee or to even Miami, just on a random Saturday.
I'm Kane Brown, and I've been practicing at TIF Regional for 11 years. I wanted to come to TIF Regional for several reasons. Number one, I thought that TIF Regional was one of the best referral centers in South Central Georgia. They offer a variety of procedures and consultants that I thought were necessary to provide good care. And once I interviewed and came to Tifton, I actually was very impressed with the diversity on the medical staff, the various cultures that were represented on the medical staff, the variance in the ages that were there, that were part of the medical staff. I was very impressed with some of the young leaders in the medical staff as well, and I felt like I wanted to join and be a part of that team. So as a kid growing up in South Georgia, I enjoy the outdoors. I knew that I wanted that type of adulthood as well. And so being able to practice in Tifton at Southwell gives me that opportunity. I live about 10 minutes from the hospital, but as you can see, I still have my outdoor experiences. I have horses, cattle, and I enjoy spending my downtime taking care of them and just being in the outdoors. And so while we have some of the most cutting edge technology in medicine 10 minutes away from here, I still get to experience some of the things that I grew up enjoying.
I'm Dr. Jessica Beyer. I'm an anatomic and clinical pathologist. I serve as the medical director for Southwell Laboratories. I also serve as chief quality officer, and I serve on the Southwell board. I chose Tifton because I am from Georgia. I grew up in Atlanta and did my residency and fellowship in Atlanta, and I was looking for a place in the Southeast where I could balance work and life. Tifton was that place. My passion outside of medicine is riding and training dressage horses, and Tifton was a great place to move to be able to balance that with my work. I have a small farm only a couple miles from the hospital, which is really convenient. Southwell has always been supportive of developing physician leaders and has a long history of a great relationship between the physicians, the administration, and the board. I stayed in Tifton because I found camaraderie between the physicians, a positive professional environment, and a great work-life balance.
Thank you again for watching this video to the end. I'm Dr. Cameron Nixon. I've been with Southwell for the past 18 years. Southwell is a great place for physician leadership, engagement, collegiality, and professionalism. But most of all, Tifton is a great place to raise a family. Thanks again.